This segment is brought to you by Best Foot Doctor New York. Treat your corns and bunions with no scars.
All right, one of the perks of summer is getting to wear sandals and show off your fresh pedicure.
That's right, but for some, exposing your toes and feet is less than ideal. Joining us now is Dr. Emmanuel Fuzaylov and Dr. Ferdinand Ruiz from Podiatry NYC, Best Foot Doctor NY. They're going to help us put our best foot forward with a special offer for our viewers.
And hopefully you.
Welcome to the show, both of you.
Thank you. Thank you.
My feet, I feel like this was tailor-made for us because we walk on our feet all day. My feet are particularly not savory. But I wonder if you could tell us, Dr. Fuzaylov, what are some of the services that you are offering or that you specialize in?
Well, the main services we're focusing on is painful bunions, corns, hammer toes, heel spurs, toenail fungus.
Okay.
Those are the things that that is your specialty. That's your area.
If we have those issues, we come to you.
And also neuromas. A lot of women suffer from neuromas. Yeah, so you wear high heels.
Yes.
Painful.
Every day.
Yeah, so a lot of women come over saying, "Doctor, I have neuroma. I treated with a lot of injections, therapy, nothing helps. What should I do?" So we came up with the solution.
Okay.
All right, we're going to get to that. But Dr. Ruiz, Best Foot Doctor NY is known for, like you said, minimally invasive surgery. So what are the advantages to a minimally invasive surgery?
The advantages are that when we make our incisions, they're small stab incisions, and our instruments are made so that when we go through the incision, we're already within the bone. So all the tissues surrounding the bunion are intact. So that creates very minimal swelling, minimal pain, because we don't have to. Traditionally, we make an incision and we have to go through all those deep tissues. I avoid all of that through a little stab incision, make my cut within the bone, so there's almost no pain or swelling. And that applies to any surgery, like neuroma surgery you were speaking about. I can make a little incision and just take away some of the, release some of the ligaments without removing the neuroma. So you don't have any after effects after that. So faster recovery. So everything is just beneficial to do it this way.
So, Dr. Ruiz, one of the most common foot problems is bunions. In the U.S., I even have them. And I think there have been so many different treatments that I personally have heard of. But how do your treatments, how did you set them apart from all the other treatments that are out there?
Well, the way we do our surgeries, like I said before, we make a small incision. So we can reposition the bones from any part of the bunion, because we have the versatility in that our instruments are able to navigate even through screws or people who have failed bunions. So we can navigate around that. But what separates us is that we can fix your bunion with a very little pain through a small incision, reposition the bone with almost no fixation at all. Sometimes we use a temporary pin, but most of the time we don't even use fixation. So you don't have to worry about having a screw or plate in there for the rest of your life.
What is a fixation?
Fixation is the way you fixate the bone. You keep the bone in place as it heals. Our cuts are made so that in angles, so that the bone is already stable as you step. So there's no need to use a screw or a plate.
That's beautiful. Okay. All right, so from the hammer toe to the bone spur, the bunion, you treat all sorts of issues. So are these surgeries that are done in the hospital?
Yeah, another advantage is we do in-office procedures, so you don't need to go to a facility, which relieves some of the anxiety that some people have. They don't, they're more comfortable in the office. Our staff is very friendly. We're very friendly, so we can make you feel comfortable. Everything is done under local anesthesia. No need for IV sedation, where you can have, an uncomfortable recovery. This way we do everything local. We place our injections very carefully, so we don't have to give you multiple pokes. So everything is geared around less pain, less swelling.
Fantastic on the patient side. Folks with arthritis often suffer from problems with their toes. How can you help?
Yeah, patients with like rheumatoid arthritis, arthritis that have a lot of inflammation, it's good for us because we can, again, make an incision with a small poke incision, avoiding all the neurovascular structure that may cause inflammation. So we're operating from within the bone without disturbing the tissues around it, which decreases the inflammation for patients that have rheumatoid arthritis or inflammatory diseases like that.
That's fascinating. Now, you guys, doctors, you have a special offer for our viewers today. Can you tell us about what that is?
So we offer all our patients free consult in all three boroughs, Queens, Brooklyn, Manhattan. Anybody with bunions, corns, neuromas are welcome to be seen.
Great.
Free consult, all right.
Thank you both for joining us. and teaching us about all the great work that you're doing over at your practice. Don't forget to scan the QR code now or call the number on your screen for that free consultation. The number is right there. Thank you both so much.
Thank you, doctors. And coming up next, we are about to move our feet. Welcoming back well-known choreographer, Tweet Boogie.
There she is. She has a